Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about the complication of blood transfusion. Okay, now from this topic you will be getting a long question or either you can get it as a short question also. So prepare that topic in such manner. What is blood transfusion? See, transfusion reaction or complication mainly refers to the effect that occurs during or after the administration of blood component. Whenever I am introducing something new to the body, there will be certain complications that will occur, right? So the complication that occurs when we are doing the blood transfusion process, that complications are called as the complications of blood transfusion. Now, if I talk about the classification can be based on two things. First thing is the time. It can be either acute or it can be either delayed. Acute one is within 24 hours and delayed one is after 24 hours. Okay. Now, based on the cause, you will be having two types, immunological and non-immunological. Okay, now immunological is antibody mediated and non-immunological is physical, chemical or infectious. Okay. Coming on to the acute transfusion reaction. Now, acute transfusion reaction is also divided. First one into the immunological one. In immunological one, the first thing that you have is acute hemolytic transfusion reaction. Now, see guys, from this classification also you will be getting a short note. Like from this AHTR, you will get a short note. Okay. So, what is the cause? Cause is there is ABO incompatibility. What is the mechanism? The recipient antibodies basically destroys the donor RBCs. As a result of which, what will happen? There will be complement activation and there will be intravascular hemolysis. Onset is within minutes 2 of transfusion. Within certain minutes of the blood transfusion, this process will occur. What are the clinical features? The person will be having fever, chills, chest pain, and hypotension and hemoglobin urea. What are the investigations I will do? The investigations that I will do is first I will see that there will be hemoglobin in plasma or urine. Then there will be positive or direct positive Coombs test. Then there will be decreased in the hepatoglobulin and there is increased in the bilirubin level. What is the prevention? For prevention, I can do cross matching and proper identification. Second thing, what is the treatment? You have to stop the transfusion immediately. Okay. Now, coming on to the next thing, that is febrile non-hemolytic transfusion reaction. Okay. See guys, I have told you from this topic, you will get either a long question, either a short question or either a very short type of question, that is your 2-mark question. So please be very careful. Please listen to this topic very, very carefully. Now, what is the cause? The cause is cytokines or antibodies against donor WBCs. What are the symptoms? There will be fever, there will be chills and they will occur after the transfusion. Okay, it is not a life-threatening condition. How will you prevent it? By giving leukocyte reduced blood. What is the treatment? The treatment is you have to give antipyretics like paracetamol. That is the only thing we know, that whenever we are talking about antipyretic, very first thing that comes to our mind is obviously the paracetamol. Okay. Next thing is you are having allergic reaction. Now, allergic reaction can also occur, right? So, what is the cause of it? The cause of it is recipient hypersensitivity to donor plasma proteins. Okay. What are the symptoms? There will be urticaria, there will be itching, flushing, and rarely there can be bronchospasm. What is the treatment? So, you have to stop the transfusion. The first line treatment whenever these complications occur should be that you should stop the blood transfusion. How will you prevent it? Washed RBCs for sensitive patients. Okay. Next thing is anaphylactic reaction. Now, why this occurs? This occurs because it is seen in IgA deficient patients. Patients who are having IgA deficiency, it is more common in them. Symptoms will be, there will be dyspnea, there will be hypotension, shock and angioedema. How will you treat it? First line treatment, I have told you, stop the transfusion. How will you prevent it? Watch 𝗲𝗵𝗵𝗵 or IgA deficient donor blood. Next thing is transfusion-related acute lung injury, TRALI. It is very, guys, just mark it with me, okay? This one is actually very, very important because when you will go to your final year also, this will be asked in your surgery. TRALI is so important, okay? So we will study that thoroughly. Definition: it is a non-cardiogenic pulmonary edema due to donor anti-leukocyte antibodies. Onset is within 6 hours of transfusion. See, within 6 hours of transfusion, even if it is asked as a MCQ in your university exams, please guys, whenever it is asked that the complications are occurring within 6 hours of the transfusion, you should mark it as TRALI. Just feed this in your head because it will be useful in your final year of MBBS also, okay? It is that important. Symptoms: there will be acute respiratory distress, hypoxia and pulmonary infiltrates. What is the treatment? Stop the transfusion, give oxygens and ventilator support. How will you prevent it? Avoid plasma with multiparous female donors, okay? First segment we have completed, that is the immunological segment is done. Coming on to the second segment, non-immunological. In the non-immunological, you have TACO. There it was TRALI. Here you have TACO. That is, TACO is also very important. What is TACO? TACO means transfusion-associated circulatory overload. What is the cause? There is rapid or excessive transfusion. That is, there is volume overload. And the symptoms, there will be dyspnea, hypotension, pulmonary edema and raised JVP. Who are at risk? Elderly, infants, cardiac and renal patients. What is the treatment? Stop the transfusion, give diuretics and give oxygen to the patient. How will you prevent it? Slow transfusion rate and monitor the volume. Next thing, septic reaction. Okay, for septic reaction, remember that there is some bacterial contamination that has happened. So, what is the cause? There is contaminated blood. The person who was responsible for giving a blood transfusion has transfused a defected blood. Okay, organism is Yersinia or Pseudomonas. Yersinia, Pseudomonas or Steph aureus. Okay. Symptoms are there will be high fever, chills, hypotension, DIC and shock. One more thing, I want you all to study about DIC. I have told you in the previous video. Go to the previous video, watch the DIC lecture once again and then pause this video and play it again. What is the treatment? You have to stop the transfusion, give IV broad spectrum antibiotics. How will you prevent it? You have to give sterile collection and storage. Next, coming on to the next is air embolism. Now, what is the cause? The cause is that air is introduced into the venous system during the transfusion. What are the symptoms? Dyspnea, cyanosis, hypotension and cardiac arrest. How will you prevent it? There should be proper priming of transfusion sets. Next, coming on to the hypocalcemia. Now, in the hypocalcemia, what is the cause? There is citrate in stored blood bins. Okay. Symptoms are there will be muscle cramps, paresthesia, tetany and hypotension. How will you give the treatment? The treatment is you have to give IV calcium gluconate. Who are at risk? There will be massive transfusion and there will be liver failure. Next, coming to the hyperkalemia. Now, what are the causes? There is leakage of potassium from stored RBCs. What are the symptoms? There will be cardiac arrhythmia. How will you prevent it? You have to use fresh blood in neonates and in cardiac patients. Next is hypothermia. Now, what are the causes of hypothermia? There is rapid transfusion of cold blood. Effect is there is cardiac arrhythmia and shivering. How will you prevent it? You have to warm the blood before the transfusion. Mainly you have to give the blood warmers. Okay. Coming on to the next thing, that is delayed transfusion reaction. Now, delayed also is divided. First thing first, you have immunological one. In the immunological one, the first I have is delayed hemolytic transfusion reaction. What is the cause? The cause is there is a response to minor RBC antigen. Okay, onset is 5 to 10 days. Symptoms are mild jaundice, fever and anemia. Lab test, there is positive Coombs test. How will you treat it? And you have to treat the cause, and it is self-limited. Next thing is post-transfusion purpura. Now, the cause is alloantibody against the platelet antigen. What is the onset? 5 to 10 days is the onset. Symptoms are, there will be severe thrombocytopenia, purpura and bleeding. For the treatment, you have to give IV to the patient. One more thing, I want you all to answer that IVIG is given for the treatment of which disease? And this disease is very, very common in children. Strawberry tongue. Write down in the comment section. Next you have is the graft versus the host disease. Now graft versus host disease is also very, very important. So we will mark at least 2 stars in front of it. Okay. Now what happens is the cause is viable donor lymphocytic attack. Okay. Onset is 1 to 2 weeks. Symptoms are fever, rash, diarrhea, pancytopenia, liver dysfunction. Mortality is very, very high. Okay. Mortality is very, very high. Just remember that. How will you prevent it? You have to stop the blood transfusion and you have to give irradiates blood for immunocompromised patient. Okay. Next you have is the non-immunological cause. So in that you are first you having the iron overload. Now the causes, there is chronic transfusion that causes iron accumulation in your liver, in your heart and pancreas. Okay. It is seen in thalassemia and aplastic anemia. What are the symptoms? The symptoms are there will be organ damage and the treatment for this is iron chelation. I will give these two to the patient and mainly I have to give the iron chelation. Okay. Next is you are having the infectious disease transmission. Here I have written the infection, route and how will you prevent it. For the hepatitis B, you have to, the route is via blood or plasma. Prevention is you have to do the screening, right? For hepatitis C, blood is the route and also anti-HCV screening. For HIV, blood is the route, you do anti-HIV screening. For syphilis, blood is the route and you do VDRL screening. Malaria is via the RBC transfusion. You have to do the donor selection and the screening. For CMV, you have to, the route is leukocytes and you have to give the leukocyte reduced screening for that. So this all are the particular things, and the things that I have marked with 2 to 3 stars are very, very important. Just read that very thoroughly. If you have any sort of doubt, please don't hesitate. Please feel free to ask me. Please feel free to DM me. Thank you so much.